So, ayan guys, thank you sa mga considerations yung uh, next week battery exam yun na, tapos next week exam, semi-final exam yun na. So, we will start on lesson 4 tapos mag-i-end tayo ng lesson 5. Okay? So, lesson 4 is all about common health problems that develop during infancy. Okay, so actually dito sa during infancy kasali din ang SIDS pero hindi ko na itatakel mamaya. Okay, since natakel na doon sa una. Nasa under siya ng lesson, ano ako doon sa lesson 3, not ko sa lesson 3. Okay, so ano nga ba intussusception? So an invagination or telescoping of one portion of the intestine into an adjacent portion causing obstruction. Okay guys, usually itong obstruction ay nakikita sa small intestine. Okay? So ito. Open picture. Ito. So guys, ito di ba yung large intestine? Okay? Dito sa loob nagkakaroon ng obstruction. Di ba? During infancy. Okay? Paano nagkakaroon ng ganun, ma'am? Usually parang sinasabi natin inborn, pero ito ay isa sa problem ng infancy. Okay? So, ayan o, ileocecal region. Okay? Usually, ayan, nakita nyo yung vessel, di ba supposed to be ganito. Tapos natutupi siya, nagiging ganyan. Okay? Ayan o, small intestine with intussusception. Okay, natupi. Natupi yung vessel. Okay? So, one of the common causes of intestinal obstruction in children, usually sa mga bata. Okay, most common between ages 3 and 12 months. More in boys than in girls, diba? So, mas maano sa lalaki kaysa sa babae. Kaya pag nakita yung invagination or telescoping of one portion into intussusception yun, guys. Kasi marami kayo may encounter mamaya. Colic, fish prongs, usually under din sa intestines yun, guys. Pero huwag kayo malilito sa ibig sabihin nila. Kung intussusception, ayun, nagkaroon ng obstruction. Okay, adjacent portion causing obstruction. Mamaya itatakin natin yung the other two na about sa stomach or intestine. Okay? So ano bang etiology? Unknown. Hindi natin alam saan. Siguro pwede siya sa viral infection, intestinal polyps, lymphoma, or diverticulum. Okay? More on, di nila alam kasi kung saan galing. Basta most of the time, ang nagkakaroon ng intussusception is children. Pinagsitaan sa mga bata. Okay, so pathophysiology is invagination. It typically begins with hyperperistalsis. Ibig sabihin ng hyper, masyadong active, okay? Very active yung peristalsis ng kanyang intestine. Ano yung peristalsis, ma'am? Usually kasi matatakel ito sa, na ano yun na to sa ano sa anatomy and physiology. If, kung natakel nyo na. Usually kasi inaano din to sa medical surgical pagdating ng third year nyo. Okay, super active ng contraction ng tiyan ng mga bata, parang ganun, paghihilab. Ayan, usually at or near the ileocecal valve. Basta pag narinig ko ileocecal valve, okay, intussusception na to. Okay? So yan, ascending, transverse, and descending colon, and then sigmoid colon, recto. Usually sa gitna. Sa gitna ha, sa may small intestine po ang intussusception. So what are the risk factors? Bata, di ba? Sabi ko nga, 3 to 12 months. Mostly sa mga girls, di ba? Mas nade-develop to sa mga bata kaysa sa mga adult. Yan, sabi ko sa boys, usually affected abnormal intestinal formation at birth. So, nung pinanganak, nagkaroon ng malrotation ng kanyang intestine. And then, prior history of intussusception and pwede din genetically, pwede din makuha family history. Okay, complications. Para siyang hernia, guys. Bowel perforation which can cause an infection of the lining of the abdominal cavity or peritonitis. Like abdominal pain, abdominal swelling, fever. Since sabi nga natin, common to sa mga infant 3 to 12 months, syempre, kaya na ba nila sabihin, masakitan siya nila? Hindi. So usually, ito yung assessment natin. Grabe yung pag-iyak. Okay? Severe paroxysmal abdominal pain. Maangat yung, di ba? Pulse up ang kanilang leg. And then vomiting of bile-stained fluid. Pag sumuka, parang tae din yung lumabas sa kanyang bibig. And then tender, distended abdomen, possibly with a palpable mass. Sa tiyan, pag kinapa mo daw ang tiyan. And then bloody mucus in the stool. Pag tumaid, duguan. So guys, common sa intussusception, pag sinabing current jelly stool, di ba? Para siyang jelly ace na tae. Pero dugo ang nilalabas. Intussusception na yun guys. Current jelly stool. Okay? Intussusception. Okay? Don't forget that. Ito yung mga common na tinatanong po sa board exam din. Oo, na ano guys, yung nung time ko 2019 ako nag-take, ito mga lumabas po ito. More on TEDJA. Okay? So don't forget that intussusception. Most common sa mga bata, di ba? Ano pa? 3 to 12 months, most common sa lalaki. Ano usually ang assessment? Meron silang current gel stool. Okay? So, diagnostic exam, pinapa-ultrasound. UTC means ultrasound. CT scan and air or barium enema can be used if intestine is torn. Pag napunit ang intestine, di natin ginagawa ang enema. Okay? Paano ba natin makikita na kung punit na ang intestine? Siyempre, by ultrasound or CT scan. And then, ano ba usually ang management yan, ma'am? Ayan, pag hindi naman punit, you can do barium enema, can fix the intussusception. Enema, di ba? Alam niyo na yun, guys. Ginawa niyo na ata yan eh, sa Redpen. Di ko alam anong year, basta enema, di ba? Naglalagay tayo ng ano sa puwet para ilabas yung dumi. Okay? Hanggang malinisan yung tiyan. So, surgery, main treatment for adults usually, surgery. Okay, nursing intervention, provide routine, pre and post-op care, and monitor for peritonitis kung babalik ulit yung infection. Okay, that's the intussusception. Next, we have failure to thrive. Uy, parang bago sa parinig to ah. Anong failure to thrive? Significant interruption in the expected rate of growth. Okay? Guys, ito failure to thrive. Usually guys, nasa 5 months na pero yung itsura is parang newborn pa rin. Ano ibig sabihin nun, ma'am? Malnourished siya actually. Hindi nag-develop yung katawan ng bata. Parang hindi nagkaroon ng growth. Okay? I know, weight less than the 3rd to 5th percentile for age on more than one occasion or weight measurements that fall to major percentile lines using the standard growth charts. Diba? Usually, chinecheck kasi natin yung timbang ng bata kung nadadagdagan per month. Diba per month, dapat nadagdagan na sila ng 1 kilo. Kasi nga, kailangan makipag-band sila with the environment. Dapat na ano na ng bata yung environment. Diba? Pero pag sinabi natin failure to thrive, ayan, sabi ko nga, supposed to be 5 months at age yung bata, pero yung katawan still nasa 1 month old pa lang. So, ayan yung failure to thrive. So, what are the causes? Yan, non-organic failure to thrive. Pag non-organic, results of inadequate energy intake. Usually, ito po yung mga mother na early formula. Okay? Or sabihin na lang natin, nagpapa-breastfeed, pero hindi enough yung nutrients na kinakain ng mother. How about organic failure to thrive? Compromised use of ingested calories and excessive metabolic demands. Okay? Hindi din enough. Pare-pareho lang hindi enough, pero magkaiba nga lang. Kung non-organic, inadequate energy. Kung organic, compromised use of ingested. Pag sinabi naman natin combination of non-organic and organic failure to thrive, meron din ganon. Diba? Binigay mo na lahat-lahat, di pa rin sapat. So, may something na sa baby niya. Okay, so usually what is the assessment? Edema including ascites. Usually edema guys, ang payat ng bata pero ang laki ng tiyan. 'Di ba? So, usually, ayan, ascites yun, guys. May sakit sa kidney, sa liver, or protein losing enteropathy. Or wasting, baka may early stage of cancer, may HIV, ayan. CP, ano ba nila ibig sabihin ng CP na yan? Okay? Let's search for that CP. Hindi din ako familiar sa CP. Okay? Then, poorly controlled inflammatory disease. Okay? That's wasting. Di ba? Usually, ay, wasted na ako. Hindi naman dahil may cancer ka. May iba-iba tayong klaseng okay, ano na term. Pero pag terminology natin dito sa nursing, wasting is, ayan, payat siya dahil meron siyang cancer, HIV, yan, kung ano man yung CP, poorly controlled inflammatory disease, okay? Hepatomegaly, okay? From the word hepa, diba? Liver, lumaki ang liver. Liver infiltration by tumor, storage disease, or cirrhosis. Heart murmur, may butas ang puso, kaya nagkaroon ng congenital heart disease. Respiratory compromise, may sakit sa baga, cystic fibrosis, bronchopulmonary dysplasia. Rash or skin changes, it causes by the HIV, congenital syphilis, cow's milk protein allergy, lupus, etc. Then hair color and texture changes, di ba? Usually naging brownish ang buhok. Tapos yung skin super dry, di ba? Dahil zinc deficiency, Menkes skin hair disease. Okay? Yan. Mental status changes. Ano ba yung CP? Let me check nga kung ano yung CP. Cerebral palsy. Di ako aware. May lumabas kasi na bata. Oh. Ay, hindi nakita. Blur. Basta bata. Cerebral palsy. Okay? Then, signs of vitamin deficiency, celiac disease. Ayan, matatakil natin mamaya. Parasites, other enteropathy. Okay? So, kaya, yan yung failure to thrive. More on ano talaga, no? Cause talaga, kung ano talaga yung cause kung bakit nangangayayat yung bata. Di ba? So, that's failure to thrive. No? Significant interruption in the expected rate of growth. From the word expected rate of growth, failure to thrive. Don't forget that. Okay? Intussusception, obstruction, failure to thrive, interruption in the expected rate of growth. So, sudden infant death syndrome, we're done with that. Di ba? SIDS. Yung sa lesson 3. Tapos natin. Okay? Bawal di ba pahigain ng naka-prone. So, dapat supine lang. Okay? So, ito na yung sinasabi ko kanina, guys. Usually, kakapatid, si interception, colic, at Hirschsprung. Mamaya. So, si colic is a form of pain which starts and stops abruptly. Okay, ito yung, guys, yung matigas ang tiyan ni baby. Diba? Hindi pa nakakatae usually. Ito yung, yung pag umiiyak, grabe, ang tigas-tigas ng tiyan nila parang bato. No. Baby colic, a condition usually in infants characterized by incessant crying. Usually, iyak ng iyak. Kasi nga masakit ang tiyan, punong-puno ng hangin, yan yung sinasabi nila. It usually starts a few weeks after birth and often improves by each 3 months. By ages 4 to 5 months, the majority of babies with colic have improved. Okay na siya. Okay? Kaya, guys, pag newborn, okay pa yung iyak siya ng iyak. Pero, may iba't iba kasing klase yung iyak nila. Parang may stages. Di ba? Meron pa yung mild, grabe, tas super grabe. Parang gano'n. Okay? So, what are the causes of colic? Overfeeding, nasobrahan. Di ba? Kaya nga, papadidein lang si baby, tapos pag nakatulog, binitawan yung nipples, okay, patulugin. Hindi yung, every 2 hours, kasi yun yung sabi ng doktor. Kahit hindi naman umiyak, pinadede mo na agad. Hindi ganun, guys. May, di ba, usually may connection nga between the breast milk of the mother tsaka ni baby. Pag iyak si baby, super tulo, no? Gatas ng dede ni mother. Di ba? May ganun instances, guys. Pero meron yung mother talaga na kahit di umiyak si baby, super dami ng milk. Kasi nga, dahil sa kinakain niya. Okay? So, causes overfeeding, Drinking milk too quickly. Diba? Bis uminom ng gatas. Grabe, nagmamadali. Lalo na usually guys, yun sa bottle feeding. Okay? Kasi hindi controlled eh. Baby ang kumukontrol dun sa battlefield. Okay? And then, hunger or tears. Pag gutom na gutom si baby, hindi mo maintindihan kung anong dumede, di ba? Pag pagod, okay? Usually, hindi siya nakapagdede. Diba yan yung mga poor sucking na sinasabi natin. Hindi nakapag-suck na mabuti si baby. Napapabayaan na ni mother. Lack of contact. Tapos, yan, temperature, itchiness, kung in pain ba si baby. Actually, hindi nga sila nagsasalita kaya hindi din natin alam kung in pain ba sila, kung anong problema. Okay? So, signs and symptoms, predictable crying episodes. Grabe, yung pag-iyak. Ayan, intense or inconsolable crying. Crying that occurs for no apparent reason. Posture changes. Okay? Hindi mo maintindihan kung anong problema talaga nila. So, intervention, hold baby as upright as possible during feedings. Pataas. Kasi pag bababa, di ba, risk for aspiration din. Okay? Kung hindi ka naman nagpapa-breastfeed, breastfeed, switch nyo po, for example, naka-formula milk. Di ba pag titikman niya yung gatas, parang bibitawan mismo ng bibig niya pag ayaw niya yung lasa. So, magpapalit ka. Okay? Or, pwede kang magpalit ng bottle. Okay? Yung nipple niya din, baka may problema. May problem dun sa bottle feeding ng nipple. Okay? And then, consider changing your diet if breastfeeding. Okay? Kasi nakadepende din sa kinakain ni mother yung lasa ng breast milk ni mother. Okay? So, that's colic. Okay? Connected with chan pa rin siya, guys. Kasi nga, yan, kung ano lahat ng, para more on, ano siya, nutrient ni baby. Kaya nagkakaroon ng colic. Okay? Then, we have trisomy 21. Oh, ito yung sinasabi natin, mental retard. Down syndrome. Paano natin ito makita? Newborn screening, di ba? Nakikita yung mga commercial na newborn screening or pag napupunta kayo sa mga hospitals, may nakikita kayo picture ng normal na bata tsaka picture ng mental retard. Okay? Kaya sabi nila, do as early as possible yung newborn screening. Kaya nga may program ng DOH na ginagawa na bago aalis, pag nanganak sa hospital, bago aalis, kailangan ma-newborn screening. Okay? Para as early as possible, malaman po nila kung ano po yung mga sakit niya. Sakit ni baby. Okay? So, paano na tawag po na trisomy 21, ma'am? Okay? Pwede naman Down syndrome, di ba? Pwede naman mental retard. Okay, usually itong sakit na to is discovered by John Langdon Down, a British physician. Okay, it is a condition in which extra genetic material causes delays in the way a child develops both mentally and physically. Okay, kasi mentally, sa pag-iisip, may cause of delay. Sa physically din, may iba din itsura. Okay? So, bihira lang po nagkakaroon ng gantong baby. Okay, for example, sa pamilya, lahat sila normal. Tapos, yung sumunod na anak, yun yung nagkaroon ng mental retard, okay, or Down syndrome. So, bihira lang po siya. Okay, usually nga guys, kaya trisomy 21 kasi it gets an extra chromosome 21 for a total of 47 chromosomes instead of 46. Sumobra. Okay, so women age 35, di ba? Above 35 is high risk. So, significant high risk of having a child with the condition. So, usually, ano po ang mga medical problems? CHD, okay, congenital heart disease. Pag usually, mga Down syndrome, guys, may tumatagal. Meron din yung parang lifespan nila is hanggang teenage, ganun lang. Depende. Kasi meron po silang, hindi lang Down syndrome ang dala-dala nila, meron din silang medical problems like CHD, yan, gastrointestinal abnormalities, musculoskeletal and movement problems, spine disorders such as scoliosis, kyphosis or lordosis. Okay? Scoliosis, di ba yung nagpa-letter S? Kyphosis, uba, lordosis, di ba? Okay. So, endocrinologic disorders, epilepsy, hearing loss, speech apraxia. Okay? Difficulty making speech sounds. Okay, sleep disorder, feeding disorder, development disabilities. Guys, depende na naman to sa IQ level ng isang um, mental retard. Okay? Kasi nakadepende, may category din yung ano guys, Down syndrome. Okay? Hindi natin matatakel yan since dito lang tayo sa overview. Okay? Kung ano lang yung common problems na nakikita natin sa infancy. Okay? So what are the signs and symptoms guys? Unang-una sa lahat, di ba, ang physical, distinctive facial features. Then mild to moderate intellectual disabilities, pananalita, nagkakaroon ng heart, kidney, and thyroid issues, numerous respiratory infections from colds, bronchitis, and pneumonia. Okay, yung kakilala ko guys na Down syndrome, actually umabot hanggang 12 years kasi meron siyang heart failure or CHD, sabi na lang natin congenital heart disease. Tapos pina-opera. Hindi naging successful yung operation niya, namatay din. Okay? Kaya parang yung family nagsisisi sila kung bakit nila pina-opera, ganyan. Pero ganun talaga. May mga, di ba, 50-50 situation pag nasa surgery talaga. Kasi it's either masasurvive or hindi. Kasi hindi din kaya ng katawan. Okay? Then, skeletal abnormalities including spine, hip, foot, and hand disorders. Di ba? Usually, kaganon yung kamay nila, nagugulat ka nila, ano yung ginagawa nila? Diba? Then, flexible joints and weak, floppy muscles. Overly quiet baby, less responsive to stimuli, vision and hearing impairment, inwardly curved little finger, and necessary abnormal space between the great and second toe, kaya hanggang sa toe pala, ano, and the unusual creases on the soles of the feet and one or both hands. So guys, usually din nakikita sa mga Down syndrome is, di ba supposed to be guys, eyes, the outer canthus should be level with our ears. Sa kanila, lower pa, mababa masyado ang kanilang ears. Hindi pantay dito sa eyes. Okay? So, look for it. Okay? Ayan guys, hindi pantay, masyadong mataas. Okay? Tapos yung kamay. Tapos sabi ito yung sinasabi, oh. Kung mama may ganito sa inyo, tapos sabi, hala, Down syndrome ako. Huwag ganun guys. Okay? Signs and symptoms lang naman, physical. Okay? Di ba kaya magkakamukha halos sa mga Down syndrome? Okay. Uy. Yan, hand features. So diagnosis is amniocentesis and DNA testing, X-rays, MRI, CT scan. Ilagay din yung newborn screening. Sana, no? Ba't kaya di nilagay? Siguro parte siya ng DNA testing, char. Ay, hindi, amniocentesis. Pwede din, di ba? Between 38 weeks, titignan nila, di ba? Naalala nyo pa, di ba? Pag 38 weeks, amniocentesis, doon din makikita. Okay? Then, cleft lip or cleft palate. Guys, 2019, June exam, board exam, ito po, tinadtad kami ng cleft lip or cleft palate. Mapa community, mapa pedya, mapa medical surgical, merong cleft lip or cleft palate. Situational, grabe. Sunod-sunod dyan ako na window. Okay? So, cleft lip is congenital anomaly that occurs at a rate of 1 in 800 births. Pag lip lang, guys, sa lips lang. Pero pag palat, dito, sa taas. Okay? So, bihira lang din nagkakaganto. Kaya, as soon as possible, ginagawa na po nila, sinasurgery na nila. Okay? Habang okay pa yung parang new pa lang yung case. Okay? Nafi-fix naman to, guys. Depende sa itsura din, di ba? So, congenital anomaly that occurs at a rate of 1 in 800 births. So, it ranges in severity from a slight dimple to a large fissure that extends from the lip up into the nasal structure. Umabot kasi siya guys, hanggang sa ilong. Di ba? Gums mo affected, lips mo affected, hanggang ilong. So, can be unilateral, On left side or bilateral involve the alveolar ridge. So clefts of the lip are more common in males. So pag cleft lip daw, more common sa males. Kasi yan guys, cleft lip. Okay? Pag sinabi naman natin cleft palate, okay? A congenital anomaly that occurs in approximately 1 of every 2,000 birds. Kung si cleft lip is 1 of every 800, same with Down syndrome, si cleft palate naman is 1 of every 2,000 birds. More common naman sa girls. Kung cleft lip is sa male, cleft palate naman sa girls. So ranges in severity from soft palate involvement alone to a defect including the hard palate and portions of the maxilla, diba? Affected. So, may be associated with cleft lip. Pwedeng damay ang cleft lip. Okay? Sa lips din. May have associated dental malformations, speech problems, and frequent otitis media. Mamaya matatakin natin ang otitis media. Okay? Results from improper dysfunctioning of the eustachian tube. May mo kawawa naman sila, no? Kaya nga, may free free fix na ganyan. Para, kasi nakaka-affect din siyempre guys sa ano to sa image, di ba, body image, nabubully, di ba, paglaki nila. So what are the etiology? Cleft lip with or without cleft palate is developmentally and genetically different from isolated cleft palate. So genetic factors, maternal drug exposure, okay? Usually si mother, may ininom na gamot, or na-expose sa chemicals or viruses na nag-affect dito sa features ni baby niya. So what are the pathophysiology? During embryonic development, the lateral and medial tissues forming the upper lip fuse between 7 weeks. So taas ko. Taas mo. Oh. O, diba? 7 weeks and 8 of age of gestation. The palatal tissues forming the hard and soft palates fuse between 7 weeks and 12 of ARG. So cleft lip and cleft palate result when these tissues fail to fuse. So what are the management? Surgery, okay? Rule of 10. Don't forget the rule of 10. 10 weeks old dapat si baby. At least 10 pounds, at least 10 grams of hemoglobin, okay? Above than, okay? Mas okay pa kung 11. Pero para hindi para maalala nyo, I mean, rule of 10. Okay, masama din sa pakiramdam ko. So nursing management is assess for problems with feeding, breathing, and parenteral bonding and speech. Okay? Hindi lang po kasi si baby ang kailangan natututo, si parent din. Kailangan meron silang counseling, di ba? Kasi bakit yung anak ko ganito dahil basta ginawa ko ganyan. Usually may gano'n kaya kina-counsel si mother, okay? Si father, tsaka nagkakaroon ng bonding between their child. And then breathing guys, kasi nga, di ba, nabanggit ko kanina, nakaka-affect din yung nasal structure din niya. Kaya hindi lang po palate, lip ang affected, pati nasal, kung umabot man hanggang sa nasal. So, they are prone to aspiration. Okay, so ayan, ensure adequate nutrition, prevent aspiration. So, provide special nipples or feeding devices. Kung cleft lip, dapat breast feeder, syringe, or medicine dropper. Ayan, guys. Okay? Kung cleft palate, wide bowl spoon. Okay? Kasi nga, kung ito ginamit natin diretso sa ilong, kung palate yan. Kaya, mas better na wide bowl spoon ang gagamitin. Okay? Hold the child in semi-upright position. Okay? Hindi literal nga semi-fowlers. Okay? Direct the formula away from the cleft. Feed slowly and burp frequently. Okay? Don't forget na hindi na i-burp sila kasi nga ma-aspirate sila kung hindi sila nag-burp. Stimulate sucking by gently rubbing the nipple against the lower lip. Okay, kung nagpapa-breastfeed. Okay, ito. Ito yung, di kasi masyadong, akala nyo nipple lang to guys. Para siyang kutsara din. Okay? Ayan. Ganyan yung tsura. Tapos isutubo. Okay? Yan yung breastfeeder. Okay? And then supports the infants, parents, emotional and social adjustment. Sabi ko nga. And then provide pre-operative care. Explain niya na. Explain surgical procedure. Provide mouth care to prevent infection. Okay? Linisin yung sugat. So surgery pag cleft lip at least 1 to 3 months of age. Okay? Roll of 10, di ba? 10 weeks old. Diba? 1 to 3 months of age pag cleft lip. Cleft palate at least 6 to 18 months of age. Itong rule of 10 lang, ginawa lang yan pag basta above 10 weeks old, pwede na siya. Basta umabot ng 10 pounds at yung kanyang hemoglobin ay 10 grams. Kaya rule of 10. Pero ito lang ay, pag for example, umabot ng 3 months, tapos nandito na yung rule of 10, okay na. Diba? 3, 6, 9. Basta 10 pounds, 10 grams, diba? Then cleft palate, okay? 6 to 18 months of age. So post-operative care, assess airway patency and vital signs. Clean the suture to, apply antibacterial ointment to prevent infection and scarring. Monitor for vital of signs of infection. Feed with rubber tip, medicine dropper, bulb syringe, breastfeeder. Keep the child from putting tongue up to palate sutures. Administer analgesics for teeth. Okay? Siyempre, iyak yung bata pag masakit. So, pag cleft lip, should supine, clean the suture line, minimizing crying. Kailangan, huwag natin silang payak-payakin. Elbow restraint. Kasi ganun-ganun niya yung bibig eh. Then, Logan bar. Ano ba ang Logan bar? Look for Logan bar. Okay. Para siyang brace, guys. Ganyan. Parang wala namang sa reviewer ko dati yung Logan bar. Ganyan, nakaganon siya. Na para siyang brace. Tapos nakaganon no bakal. Okay? Para i-support to. No? Logan bar. And then si Logan bar is to prevent overstretching, suctioning of the lips. Diba? Usually, pag pinapatawa, diba, umaano yung labi, binibig. So, cleft palate naman is prone. Para yung laway ng baby is nada-drain. Diba, lumalabas mismo. Then, minimizing crying. Elbow restraint, no deep or vigorous to suctioning, and use finer tube. So, take note, remove restraint every 2 hours. Then, perform range of motion. Okay? Hindi naman forever na ano. Kailangan na i-practicein din natin na kaya nilang galawin. And then, after repair, refer speech therapy and child psychologist, EENT. Usually, sino yung mga EENT doctors? Diba? Yung mga eyes, ears, nose, di ba? Sila yung mga doktor na yan. ENT. Okay? Eyes, ears, nose, throat, doctors. Okay? Frequent infection because of respiration, drying of mouth is common. So, and then orthodontist. Okay? Dentist to, orthodontist. Kasi ngipin. Then, we're done with CL and CP. Okay? CP kanina cerebral palsy. Cerebral palsy. Okay, so next we have imperforated anus. Okay? Part pa siya ng ano yan. Kaya nga guys, di ba? Sa newborn, pine-perform po natin ang pag-check ng temperature through rectal para makita natin kung may butas ang puwet. Yun yung rationale niya. So, ano naman connecting perforated anus? During embryonic life, membrane that separates the rectum and anus is absorbed. Absorption fails to occur. So, anus appears as a dimple. Diba? Walang butas ng puwet. So, fistula may be present rectovaginal or rectourethral. So assessment, absence of stool during first 24 hours, inspection of anus for patency. Okay, kaya sa rectal tayo kumukuha ng temperature dahil hindi dahil mainit doon. Diba? Kahit ano-ano yung mga naisip nila, kahit ano-ano yung rationale na naisip nila, hindi nila naisip kung may butas ba ang puwet. Kasi nga, inborn din niya. So what are the interventions? Anoplasty. Ano yung anoplasty? Kindly search. Temporary colostomy. Colostomy is, di ba? Colostomy bag, naalala nyo? Maglinis kayo ng ano, di ba? So, colostomy. Bubutasan for the meantime yung tiyan. Then, ayan. Nasogastric suction if with distension. So, nursing intervention, anoplasty, alam nyo na yan. Basta. Di ba bubutasan yung puwet if possible. So, nursing intervention, keep operative site clean. Laging malinis dapat. Observe for signs of hypovolemic shock from the word hypo. If anoplasty heals, regular dilation of anus. Ganun. Okay? Post-op, side lying or prone with hips elevated. So, beware of SIDS. Diba? So, that's imperforated anus. Then, we have Hirschsprung's disease. Kung si intussusception is very active, si Hirschsprung is hypoactive. Pero sa large intestine, kasi si intussusception very active sa small. Si Hirschsprung is hypoactive sa large intestine. Hindi active yung pag-move ng food. Okay? Diba supposed to be, di-deliver niya yung kinain mo. Pag na-absorb na ng body yung vitamins, minerals, diba? O, i-excrete na. Hindi siya gaano nag-excrete kasi nga hindi nagmo-move ng mabuti yung tiyan. Yan, absence of autonomic parasympathetic ganglion cells enlarged. From the word absence, walang parasympathetic movement sa tiyan. So, characterized by the absence of nerves to a section of the intestine. Ayan. Healthy section, tapos disease section. Parang nag-gangrene, nag-block. And then the rectum and anus. O yan. Without nerve cells. So, results in mechanical intestinal obstruction due to inadequate motility. Wala siyang motility. 4 times more common in boys than girls. So, boys na naman. Grabe, no? Seen more common in children with Down syndrome. Okay? It can be acute and life-threatening or chronic. Pwedeng acute, pwedeng chronic, or life-threatening daw, guys. So, etiology, usually familial or congenital defect, results from failure of the craniocaudal migration of ganglion nerve cell precursors along the gastrointestinal tract between the 5th and 12 weeks of gestation habang nasa sinapupunan. So, pathophysiology is absence of autonomic parasympathetic ganglion cells, ayan, lack of innervation leads to absence of propulsive movement. Basta, tamad kumilos yung kanyang, large intestine. There's no motility. Yun lang yung, natin sa Hirschsprung. Assessment findings, pag neonates daw. Neonates is newborn. Failure or delay in passing meconium, walang taing lumalabas. Reluctance to ingest fluids, abdominal distension, matigas, bile stain, vomitus, pag sumuka, tae ang kulay. Okay, pag infant naman, yan yung sinasabi ko, failure to thrive, constipation, vomiting, fecal or episodic diarrhea. Okay, in older children, anorexia, mapayat, chronic, constipation, foul smelling and ribbon-like stools. Ito guys, lumabas to sa board exam. Yung foul smelling and ribbon-like stools. Common in children. Okay. Abdominal distension, palpable fecal mass, malnourishment or poor growth, signs of anemia and hypoproteinemia. Okay, laboratory and diagnostic study findings. Ayan. Same lang sa sa intussusception, barium enema reveals megacolon. X-ray using a contrast dye para makita yung sa may stomach. Rectal biopsy reveals absence of ganglionic cells. Papasok yung camera sa puwet. Rectal Ito, manometry. External sphincter contracts normally but fails to relax. Okay, gumaganon. Di ba? Parang may silbi yung puwet. Gumaganon, di ba? Basta gumagalaw siya. Gumaganon. Pero walang lumalabas. Okay? So what are the nursing intervention? Assess for and promptly report signs of enterocolitis. Promote adequate hydration. Assess bowel functioning. Assess the passage of meconium in neonates. Kaya nga nilalagyan na, di ba, ng thermometer. Actually, nagkaroon ng case ng ganyan sa hospital noong nakaraan. Hindi pa siya tumatay simula nung lumabas. Doon, nakuha na naman siya ng thermometer doon. Binigyan pa nga siya ng suppository, walang lumabas. So, ang ginawa ng nurse, tinusukan niya ulit ng thermometer. Kasi ang tigas na ng tiyan ng bata. So, ang nangyari, ayan, nag-NPO sila, no, nating per orem, hindi siya pinadede from 11 p.m. to 4 p.m. Okay, grabe no, tagal. Ay, 11 p.m. gabi pa yun. Tapos 4 p.m. kinabukasan. Hindi pa rin lumalabas. Tinusok niya. Tapos biglang, whoosh, bulwak bigla ang takain ng bata. Yeah. So, periodically measure abdominal girth to assess for increasing distension. Diba? Napakwento si ma'am. And then promote adequate nutrition according to the child's age and nutritional requirements, smaller and frequent feeding, and then administer enema as prescribed by the doctor. To relieve constipation, avoid taking temperature rectally. Okay? Pag newborn kasi guys, sa puwet, di ba sa una. Tapos pagdating sa ward, ayan, na-adapt niya na yung environment, pwede na tayo sa axilla, di ba? Pero yun nga, yung nakwento ko guys, since hindi pa rin siya nakakatayo, ni-try lang nung nurse na iput yung thermometer rectally. Yun nga, naging effective na lumabas yung tayo. Siguro hindi lang bumuka ng mabuti yung anus. No? Kahit nilagyan pa ng suppository. Okay? Then administer prescribed medication, antibiotics, stool softener. Then decrease discomfort causing by abdominal distension, elevate the head of the bed, change the child's position frequently, and assess for any respiratory difficulty. Then support the child and parents. Kausapin natin sila, i-counsel natin sila, and then prepare the child and the parents for procedures and treatments like manual dilation of anus, dietary management, cleansing enemas, and temporary colostomy before surgery para lumabas po lahat ng bile, okay? Or yung dumi. Actually, guys, when that, nung kagaya nyo pa ako, guys, student, di ba, nag-aaral ako sa Manila, nag-duty ako sa hospital, sakto, naging pasyente ko, yung Hirschsprung ang case. Bata siya, parang 6 or 7 years old, ganun. Nangangailangan sila ng blood kasi nga maoperahan. So, nag-volunteer ako. Pero, unfortunately, hindi ako nakapasa nga dahil puyat ako that time. So, yun, nakakaawa lang siya. Sana okay na siya. Tagal-tagal na din kasi. Okay? So, we have intervention pre-operative nursing responsibilities. We have to prepare the bowel for surgery with repeated saline enemas. Dapat nga, di ba, bago ma-operahan, ilabas muna natin dumi sa katawan. Okay, so systemic antibiotic and colonic antibiotic irrigation to decrease bowel flora. Not necessary for neonate. How about in post-op care? Nothing per orem. Wala mo nang kakainin. Monitor the input and output. Input is, kunwari, since naka-NPO ang pasyente, input, nakaswero. So, ilan ang pumasok na swero sa kanya, di ba? And then, NGT drainage. Okay, lalabas yung dumi sa through NGT. Okay? Lavage. Kasi pag lavage papasok, lavage lalabas. Keep the infant's diaper away from the dressing to prevent contamination, providing ostomy care if indicated. Kung nakalagay po sa doctor's order. So that's Hirschsprung disease. O diba? We have intussusception, colic, imperforated anus, and Hirschsprung. Okay? Don't forget that. And then next, last ba to? Parang next pa lang. Spina bifida. Okay? So, central nervous system defect that occurs as a result of neural tube failure to close during embryonic development. Nagkaroon na po ng problem sa central nervous system. Though normal siya, pero nagkaroon ng protrusion. Okay? Defect closure usually done by during infancy. Ma'am, ano to? Okay? Ano tong bukol? Kaya naka-prone position siya kasi hindi pwedeng ihiga to, guys. Okay? May butas sa kanya. Kaya nga spina bifida. Okay? Nag-protrude. May butas sa area na to na namuo ang kanya spinal fluid. Okay? Usually, nakita ko to guys sa may Philippine Orthopedic Center. Okay? Doon sila naka-hospital. Usually, yung mga ganyang cases. So, what are the risk factors? Folate deficiency. Ayan, yung mga nanay na hindi nagtitake ng iron vitamins, diba? Ferrous sulfate. Kaya, diba sabi ko sa anemia, dapat nagtitake sila ng ganito. Okay? And the family history of NTD, neural tube defects. Some medications, mga ininom na mother na kahit ano, diba? Yung mga umiinom ng mga herbal daw, maganda sa buntis yan. Ganyan yung nangyari. Okay? Kaya nga, pag may nirecommend ng doktor, yun lang. Wala nang iba. Okay? And then, obesity, candidate. Sabay ganun. Tapos, increased body temperature kasi may infection. So, we have 3 types of spina bifida. We have spina bifida occulta, spina bifida meningocele, spina meningocele, spina myo-meningocele. Meningocele, myo, usually myo, pero myo-meningocele ang ano namin dyan. Meningocele and myo-meningocele. Silent, L. Okay? Pag sinabi natin spina bifida occulta, okay? Pinaka-mild po sa kanilang lahat, ayan. Small separation or gap in one or more of the bones of the spine. Okay? Ito yung common, yun nasa picture kanina. Si occulta. So, posterior vertebrae arches fail to close in the lumbosacral area. Nasa baba, lumbosacral. No surgical management, just protect the area. Okay, kaya naka-prone position lang si baby. How about meningocele? The protective membranes around the spinal cord meninges push out through the opening in the vertebrae, forming a sac filled with fluid. Okay? Sac with fluid. Okay, so malambot-lambot. Myomeningocele, also known as open spina bifida, it is the most severe form. Pinaka-severe daw. Kasi ito ay protrusion na meninges, cerebrospinal fluid, nerve roots, and portion of spinal cord. SC, spinal cord, no? Ayan, nag-protrude na. Kaya ito yung fluid, do. Ayan. Normal spine supposed to be ganyan. Ito, nag-leak, parang nag-leak yung, ano yun? Spinal fluid niya. Okay? So, pinakamalala is myomeningocele, pinakamild is occulta. Meningocele is meninges pass back through the opening in the spine to form a cyst-like swelling. Pero ito ay, si myomeningocele is a cyst called, this is the most serious type of spina bifida. Okay? Ayan. So, assessment depends on spinal cord involvement. Pag occulta, it does not affect the spinal cord. So, nagkaroon lang ng dimpling para lang tigyawat of the skin, nevy, or hair tufts. Pag meningocele, spinal cord is not involved. No neurologic involvement. Pero pag myomeningocele, similar to meningocele, but the spinal cord and accompanying nerve roots are involved. Most severe and most common type of spina bifida is myomeningocele. Involves sensory motor deficits, urinary and bowel problem, utero joint deformities associated with dislocation of the hip and club foot. Okay, club foot, nakaganon yung paa. So what are the complications? Orthopedic, ayan, kaya pala nasa Philippine Orthopedic Center kasi nga orthopedic complication siya. So accumulation of fluid in the brain, hydrocephalus. Okay, infection in the tissue surrounding the brain, meningitis. Most of the meningitis kasi guys, nagsi-seizure pa yan. Then sleep disordered breathing, skin problems. So interventions, administer antibiotics, anticholinergic, laxatives, antispasmodic, kasi di ba nagkaroon na din ng problema sa tiyan. Evaluate the sac, measure lesion, monitor for increased intracranial pressure, and then protect the sac, cover with sterile, moist, basa. Change dressing every 2 to 4 hours para kasi risk for infection. And then place them in prone position. So that's spina bifida. Okay, don't forget. Si occulta is the mildest, and then meningocele is the malala, severe and common type. Okay? So, we have hydrocephalus. Okay? Ito yung guys, nakikita yung malalaki ang ulo ng bata. Hydrocephalus. Dahil, from the word hydro, matubig. Okay? Imbalance of cerebrospinal fluid production and absorption in the ventricular system caused by malformations, tumors, hemorrhage, infection, trauma. So, we have two types. Okay? We have communicating impaired, communicating and non-communicating. Pag communicating, impaired absorption within arachnoid space. Arachnoid space, pag communicating, non-communicating is obstruction of cerebrospinal fluid flow within the ventricular system. So what are the etiology? Ayan, ito rin sinasabi ko guys. Ang laki ng ulo. Okay, congenital hydrocephalus results from a defect Chiaris malformation. Chiaris malformation. Okay? Congenital hydrocephalus associated with spina bifida. Acquired hydrocephalus results from space-occupying lesion, hemorrhage, intracranial infection, or a dormant developmental defect. Okay, look for this guys. Oh, ang laki ng ulo ni baby. Oh. Hindi dahil sa inborn, di ba? Dahil hindi na prolong paglabas, talagang ganyan na guys. Makikita nyo siya habang lumalaki. Okay? So what are the pathophysiology? Primary site of CHS formation is choroid plexus of the lateral ventricles. Impaired absorption of CSF in the arachnoid space or obstruction to the flow of CHF through the ventricular system. Basta pag narinig nyo na si arachnoid tsaka si ventricular system, ay, okay, hydrocephalus na po. Okay? So what are the impaired absorption can result from meningitis, prenatal maternal infection, meningeal malignancy, and an arachnoid cyst or TB. Okay? So what are the clinical manifestations in infants? Yeah, abnormal rate of head growth. Masyadong malaki ang, yeah. Diba? When we do the anthropometric measurement, masyadong malaki ang ulo. Yan. Anterior fontanelle tense bulging. Ito, yung fontanelle guys, diba yung may parang butas part dito yung baby. Bulging siya. Supposed to be, dapat malalim siya eh. Kasi alam mo yung parang triangle shape sa ulo. Ah, okay. Parang may butas kasi hindi pa full developed. Dito kasi guys, bulging. Bulging pag hydrocephalus. And then dilated scalp veins. Yan, Meeswen sign. Ano yung Meeswen sign? Cracked pat sound on percussion of bones of head. Okay? Then frontal bossing, setting sun sign. Yan, ganun yung ay. Alam mo yung parang pataas na yung araw. Di ba yung sunrise? Ganun yung tsura ng mata nila. And then sluggish and unequal pupils, irritability and lethargy and cranial nerve damage. Okay? Diba yung mata nila? Diba? Ito masyadong normal yung mata nito. Pero usually guys, alam mo yung nakakatakot na mata ganun? Hindi siya nakakatakot. Basta pa-sunrise na mata. Parang ganun yung mata nila. So, what are the manifestation in children? Okay? Signs and symptoms of ICP is headache on awakening with improvement after emesis, papilledema, strabismus, ataxia, irritability, lethargy, and confusion. So what are the diagnostic exams? We have ultrasound as early as 14 weeks and CT scan, yan, computed tomograph, okay, yan yung ibig sabihin ng CT scan guys ha. Postnatal diagnosis and MRI scan or magnetic resonance imaging used if a complex lesion is suspected. So guys, alam ko ang question nyo sa hydrocephalus. Ma'am, tumatagal ba yung batang ganyan? Bihira. Okay? Natadaan naman sa surgery guys, nababawasan yung fluid. May ganong surgery, nababawasan. Tumatagal sila usually hanggang siguro school age, 12 years old. Sa ano ko, ano to? 12 years old, parang malabo. Bihira lang 12 years old. Siguro mga 5 to 8 years old, pwede pa. Pero yan, hirap pa rin kahit na operahan, ganyan. Hindi kasi, syempre, na-develop na dati na lumaki ang kanilang skull, tinanggal lang natin, di ba? Nag-AV shunt lang. Yung AV shunt pa may nandito. Dinrain lang yung fluid sa ulo, di ba? Pero ganun pa rin, ganun pa rin yung structure ng head, malaki pa rin. Okay, so nursing management, syempre, teach the family about the management. Treatment is surgical, direct removal of the obstruction, insertion of shunts, to provide primary drainage of cerebrospinal fluid, yung fluid sa ulo. Then major complication of shunts, yan, infections, malfunction, and subdural hematoma. So provide pre-operative care, assess the head circumference, the fontanelles, the cranial sutures, and the level of consciousness, LOC. Check for irritability, altered feeding habits, high-pitched cry. Yan, firmly support the head and the neck when holding the child. Provide skin care for the head to prevent breakdown. Give small frequent feedings to decrease the risk of vomiting. How about in post-op? Assess for signs of intracranial pressure. Check the head circumference daily, anterior fontanelle for size and fullness, administer antibiotic and analgesics as prescribed. Provide shunt care for infection and malfunction. Yan yung shunt, sabi ko nga. Rapid onset of vomiting, severe headache, irritability, lethargy, fever, redness along the shunt tract, fluid around the shunt valve. So surgical implementation, we have VP shunt, okay? Ayan, dinedrain po natin yung peritoneal cavity from the lateral ventricle. Pero most common is AV shunt. CHF drains into the right atrium. Okay? So post-op care, keep child flat prescribed 10-15 days. Walang una. Observe increased intracranial pressure. Monitor for infection, input and output. Measure head circumference once a day. Okay? Provide comfort measure, administer medication like diuretics, antibiotics, or anticonvulsant. Kasi nga, nagkaroon ng infection, di ba, nag-seizure. Prevent skin breakdown. Okay? So, paano yung VP shunt, ma'am? Yung ventriculoperitoneal shunt placement. Okay? So, ayan. Extra tubing in peritoneal cavity for growth. So, dito, ayan, dito, para ma-drain. Okay? So, surgery talaga siya. VP shunt or AV shunt, ha? Wala. Common din na, ganun din si AV shunt, pero sa right atrium lang nilalagay, no? Sa heart. Okay? So, we have otitis media. Okay, sa tenga po to guys. Infection of the middle ear occurred as a result of a blocked eustachian tube preventing normal drainage. Common complication of ARI. Infants and children more prone, ET shorter, wider, straighter. Ayan, eustachian tube ET ha. Ayan guys. Nagkaroon ng obstruction, so otitis media. Usually guys, yan yung mga infection. Or yung mga baby na hindi napapa-burp na mabuti, nagkaroon ng aspiration, napabayaan, namuo yung gatas sa tenga. Okay, so common cause is bacterial viral infection. Dahil doon sa mga pira-pirasong gatas, ayan. Risk factors, ayun, sabi ko guys, passive smoking, being fed formula milk rather than breast milk, feeding a child in supine position, yan na yun guys, having a cleft palate or having Down syndrome. Okay, yan. Kaya nagkakaroon ng obstruction, nagiging infection. So complication is mastoiditis, labyrinthitis, meningitis. Okay, basta from the word itis, nagkaroon ng infection. So what are the signs and symptoms? Ayan, mataas ang lagnat, irritable, restless, rolling of head from side to side, pulling or rubbing the ear, URAC, signs of hearing loss, purulent ear discharge. So diagnostic is otoscopic exam, yung binivisualize yung tenga. So intervention, encourage fluids, upright position when feeding or semi-fowlers, avoid chewing, increasing pain, have the child lie with the affected ear. Okay, kung ito masakit, nakahiga siya ganun. Para, di ba, from the gravity, the down siya. Have the child lie with the affected ear, appropriate technique to clean drainage, administer analgesic and antibiotics 10 to 14 days. Then screening for hearing loss, laryngotomy. Okay? So what are the nurse management? Assess the child for fever and pain level and assess for possible complications. Yan, medication, bababa yung fever, yung pain, prevent skin breakdown, provide pre-op and post-op care, and provide child and family teaching. Halos pare-pareho lang naman yung mga yan, no? Yung ng management. And then we have meningitis, from the word meningitis, diba? Infection sa ating central nervous system, okay? Infectious process of the CNS caused by bacteria and virus, acquired as primary or as a result of complications. The diagnosis is CSF analysis, increased pressure, cloudy central spinal fluid, high protein, low glucose. So guys, common to usually sa mga baby, I think so. Alam mo yung nag-seizure bigla-bigla, ito yun, meningitis guys. Kasi may affected sa kanyang central nervous system. So assessment, signs and symptoms vary depending of each group. Fever, chills, vomiting, diarrhea, poor feeding or anorexia, headache with nausea and vomiting, sensitivity to light. Ayan, seizure, sabi ko kanina. Altered level of consciousness, bulging fontanelle, nuchal rigidity. So newborns infant may show these signs. Okay? Dito nyo makikita yung tonic and clonic. Yan. High fever, constant crying, excessive sleepiness or irritability, inactivity, or sluggishness, poor feeding, a bulge in the soft spot on the top of baby's head, stiffness in a baby's body and neck. Guys, pag napabayaan ng meningitis, pwede pong mamatay si baby or yung bata. Okay? So, ayan guys. We have tests. Okay? Naka-straighten ng bata, pag tinaas ang ulo, pag nagpataas ang kanyang paa, he is positive sa Brzezinski neck sign. Positive. Diba? Inuna mo, inangat yung ulo. Sumabay yung paa. Biglang umangat. Kasi supposedly pag tinaas ang ulo, hindi kaangat yung paa. Inangat mo yung ulo, tumaas ang paa, positive po siya sa Brzezinski neck sign. How about Kernig's? Okay? Usually guys, pag tinupi mo tong paa, pag tumunog, okay? Parang nagka-crack sound. Pagka ganun, crack, 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 crack. Pag tinataas, nagka-crack, crack. Positive siya sa Kernig's sign. Okay? Usually, di ba? Minsan lang dapat tumunog yan. Kung na-move. Pero yan, kahit ilang ganun mo, tumutunog siya, he is positive in Kernig's sign. He or she is positive in Kernig's sign. Okay? So, most strains of bacteria, yan. Common na common si Streptococcus pneumoniae, Neisseria meningitidis, Haemophilus influenzae, Listeria monocytogenesis. Okay? Implementation, isolate guys. Okay? At least 24 hours after antibiotics are initiated. Monitor vital signs and neurostatus, monitor INO, assess nutrition status, determine close contacts of the child with meningitis. Guys, usually nilalayo po natin ang mga batang may meningitis malapit sa ward. Bakit, ma'am? Dapat ang face kasi ng mga nagsiseizure is nasa tahimik na area, hindi masyadong mailaw, sensitive kasi sa light, and dapat rest, as in naka-rest lang yung bata. Kasi matitrigger po yung kanilang sakit pag naka-encounter na maingay, sa ilaw, di ba? Nakakayang ayan, yun. Kaya naka-isolate sila. So that's the meningitis. How about febrile seizures? From the word febrile, pag febrile, di ba, nilalagnat. Okay, so pag nilalagnat ang bata, pwede din po mag-seizure. Okay? So febrile seizures are convulsions brought on by a fever in infants or small children. Rectal temperature is greater than 102 Fahrenheit. Most, usually ito guys, 40. No? 38 to 39 to 40. Nagsiseizure na. So most febrile seizures occur during the first day of the child's fever. So factors is young age, less than 15 months, o ilan taon ng 15 months. Diba? 1 year and 3 months during the first seizure, frequent fevers, having immediate family members with a history of febrile seizures, baka nahawa. So during seizures, loses consciousness and shakes moving limbs on both sides of the body, rigid or has twitches in only a portion of the body. Last a minute or two. Usually may seizure kasi na magalaw, may seizure na parang tahimik lang, di ba? So usually pag nagsi-seizure guys, ito, mayroong yung during the seizure ito, biglang tonic phase, umaangat yung katawan. Meron din clonic phase yan, parang nagka-curve naman. Okay? Tonic, paangat, clonic, pababa. Okay? So, intervention during seizure. So, priority ang safety nila kasi risk for fall or risk for injury ang mga bata pag nag-seizure. Place on a protective surface such as the floor or ground. Not be held or restrained. Place on his or her side or stomach to prevent choking. Gently remove any objects from the mouth. Look at your watch when the seizure starts. Okay, wala kayong dapat kung usually pag nagsi-seizure din sa matanda, tinatanggal natin yung postiso. Eto naman, bata naman. So, kung ano man yung nasa bibig, tatanggalin natin. For example, naka-pacifier, tanggalin natin. Look at your watch when the seizure starts. Last 10 minutes, medically facility. Okay, check nyo kung ilang minutes siya nag-seizure. And then, provide oxygenation. Pag nag-seizure, agad oxygen. Okay? Then, I think this is the last one. Autistic or the ADHD. So, first, we have Attention Deficit Hyperactive Disorder, ADHD. Okay? Ito yung mga kulang sa pansin. Di ba? Hindi sila napapagod. Kahit pinaupo mo sila ng ilang minuto, hindi sila mapakali. Okay? So, most common behavioral disorder of childhood, one of the most prevalent chronic health conditions affecting school-age children, 5 to 10%. So, yeah, inattention, including increased distractibility. Sakit pala man yung ganung hyperactive. Yes. Okay? Poor impulse control and decreased self-inhibitory capacity, motor overactive, and motor restlessness. Epidemiology, studies of the prevalence of ADHD across the globe have generally reported that 5 to 10% of the school-age children are affected. Many children with ADHD also present with comorbid psychiatric diagnosis, including Yan. Basahin ko pa, di ba? Diyos ko. Nababasa nyo naman na. Sino po yung mga actress? 7 years old. Mas common sa boys kesa sa girls. Puro boys. Okay? So ano nga sa meningitis, saan ba? Hydrocephalus. Mostly sa girls ko nakikita. Though wala pang atang research about it. Ewan ko lang. Kasi dito, with research na to, kaya yan. More on boys. So causes, walang vaccine. Okay? Poor parenting. Ayan. Places na hindi aware sa mga bakuna. Ayan. Sa mga parent na smoker or uminom ng alak. Yan, premature, low birth weight, nagkaroon ng injury, Okay, and then, ayan, early television watching and future attention problems. Yan din yung causes ng ADHD. Okay, mga kulang sa pansin. Yan yung sinasabi nila eh. Evidence suggests that there is no single factor that determines the expression of ADHD. Multiple factors have been implicated. Yan. Abnormal brain structures are linked to increased risk of ADHD. So, pathogenesis, ayan, MRI, usually nakikita, yan, 5 to 10% reduction of the brain volumes of specific structures such as prefrontal cortex and basal ganglia. Low blood flow to the striatum and fluorodopa positron emission tomography scans have also supported the dopamine. Okay, low levels of dopamine activity daw. Kung kailan pahuli na, nag-iba na, no? So, clinical manifestation, the first subtype is inattentive type. Okay? Often includes cognitive impairment and is more common in females. Also, ito naman sa mga babae. Yung first type. Pero yung second and third common sa males. So, super active, impulsive, or pwede din maging first and second type siya. Ay yung combined type. Okay? May time na inattentive, meron yung attentive. So, diagnosis is clinical interview and history. Okay? And then, huwag ko nang basahin. Kayo na bahala dyan. Physical examination laboratory, ayan. We have no laboratory test daw to identify ADHD. Upon ano lang, physical examination. Ayan, impaired fine motor movement and poor coordination, other soft signs. Finger tapping, alternating movements, finger to nose, ayan yung mga ganun-ganon. Diba? Sa mga range of motion. Diba? Sa assessment natin, physical assessment. So, treatment is psychosocial treatments, behavior-oriented treatments, and then medications para mag-relax. And then prognosis, ayan guys, mga common medication na binibigay para mag-relax sila. Okay, so childhood diagnosis often leads to persistent ADHD throughout the lifespan. Yan. These risk factors include engaging in risk-taking behaviors. And sexual activity, delinquent behavior, substance use, educational underachievement, or employment difficulties, and relationship difficulties. That's the ADHD. Super active. Mga kulang kasi sila sa pansin. Pero, ito it's either nagkakaroon yung bata o matanda. Depende po. Okay? How about yung autism? Ito sa isa sa hindrance, di ba? Kilala niyo si Candy Pangalinan, di ba? Sobrang grabe yung struggles niya sa anak niya, autistic. Anak ni Chris Aquino, autistic din, di ba? Kung sino pa yung mga mayayaman, sila pa yung nabigyan na anak na ganyan. Pero hindi naman natin sila masisisi kasi may mga chances talaga, di ba? Biglang nagkakaroon ng gantong instances. Okay? So, autism is a complex development disability that typically appears during the first 3 years of life. Gulat sila, di nagsasalita, hindi sila sociable. Diba? It is characterized by a behavioral phenotype that includes qualitative impairment in the areas of language development. Di nagsasalita, diba? Communication skills, the social interaction, diba? Autistic, yan, autism. So diagnosis is a total of 6 or more items from 1, 2, and 3 with a list of 2 from 1 and 1 each from 2 and 3. Ibig sabihin nito guys yan, no? Yung mga klase na yan, qualitative, impairment, ayan. Ayan. As manifested by these 2 of the following. Marked impairment in the use of multiple nonverbal. Yan na ngayon guys, yung diagnosis, yung pag kinakausap mo, hindi siya nakikinig. Pag may tinatanong ka, di siya nagsasalita, titignan ka lang niya, may papagawa ka, wala siyang gagawin. Okay? As in, hindi siya attentive. Parang out of nowhere yung kanyang pag-iisip. Yan. Dami, no? Yan. Kaya, salute ako talaga sa mga parents na nag-aalaga ng gantong klaseng anak. Autism. Okay? Paano naging super mom sila the way na paano nila inalagay yung batang yun, di ba? So, yan. We have two nga, qualitative and quantitative. Quanti ba to? Qualitative impairment in communication. Ito, interaction. So, may dalawa. Eh, meron pa pala ito, restricted, repetitive, and stereotype patterns of behavior. Para lang siya mental retard, no? IQ naman ang basehan kasi sa ano, Down syndrome. Dito naman sa autistic may tatlong level. Qualitative, na social interactive, qualitative sa communication, and so restricted, repetitive, and stereotype patterns of behavior. So, and then we have, yan. Lastly na, clinically features. Yan. Impairment in joint attention is the inability to use eye contact. Hindi sila nag-eye contact. Okay. Yan, siguro. More on read nyo na lang to, guys. Yan. Yan. Most of the autistic child is often withdrawn and spends hours in solitary play. Di ba sa Eric Erikson, guys, pagkihanap pang solitary play. Ano ba yon? Yan, ritualistic behavior. Para silang, di ba, sino to? Sa The Good Doctor, autistic din yun. Oh. Yan, may natutunan kasi ako by watching din, di ba? Ano ko yung ugali ng mga autistic. Ang galing ng artista, no? Paano niya na ano si Dr. Sean. Sa etiology, the exact cause of autism is unknown, hindi natin alam, but is believed to be multifactorial with a strong genetic influence. Okay, usually identical twins or fraternal twins. Yan. About sa chromosomes, usually. Yan. Incidence sa US base, 1 out of 68 children daw. And mas common sa boys. Yan. So, diagnosis is, ayan, we have ASDs, and aberrant social skill development is the hallmark of autism spectrum disorder. And early social skill deficits may include abnormal eye contact, failure to orient to name, failure to use gestures to point or show. Basta sobrang tamad nila. Hindi lang sa sobrang tamad, parang pag may iutos ka, hindi sila nakikinig. Parang tulala lang sila. And then, merong tinatawag na chat, screening tool designed for use with 18-month-old children in primary care setting. So, ano yung chat? Checklist for autism in toddlers. Kasi ilang taon na ba yan? 18 months, di ba? 1 year and 6 months. So, there is no medical cure for autism. Wala po talagang clinical o medical cure sa autism. Kaya nga, di ba? Nakikita nyo yung may autism na anak. In-embrace na lang nila, tinuturuan na lang nila. So, we have triads, actually, na, ayan. Social interaction, communication, and behavior. So, from the word triads. Okay. Social, communication, and behavior. Okay. Social interaction exhibits poor or typical eye contact. Pag may nakipaglarong bata sa kanila, hindi sila sumasabay. Okay. Failure to respond or has a delayed response to his or her name. How, ayan, prefers to be alone, mapag-isa, does not seem to be aware of others or their feelings. Di ba kahit papatayin yung kasama niya, eh wala siyang pake. Yan. Feels to develop. Pero depende kasi mayroon namang autism na ganun, na may care sila. Okay, communication, bihira magipag-usap. Okay? Nahihirapan magsalita, nahihirapan, parang pag magsalita sila, yung parang kahit sabi mo magsinungaling ka na ganito-ganito, eh, sasabihin nila yung totoo, parang wala silang pake. Parang ganun yung dating ng communication nila. And then behavior, okay? Para silang OC, obsessive compulsive, kung ano yung, ay, parang naalala ko, kung mahilig kayo manood ng Korean drama, di ba meron yung lawyer? Nakalimutan ko yung, ano, yung gumaganong-ganon pa. Basta yung lawyer na yon, di ba? Autism din yun. Di ba? Nakita nyo yung ginagawa niya, yung OC siya, obsessive compulsive. Pag may na konting misplaced lang, inaayos. Okay? Tapos, pag may sasabihin siya, parang nag-i-imagine, ganon. Tapos, paulit-ulit yung routine niya lagi. Tapos, yung steps dapat na, yung hagdanan niya dapat kompleto, ganon. Ganon yung behavior ng autistic. Okay? So, that's all for lesson 4. Para next week, we will have our lesson 5. Okay? Quiz tapos lesson 5. Okay? So, ayan. Buti kaya pa ng boses ko. So, that's it. I already sent the file. Kindly read, review for your battery exam na din. Okay? Yan lang. Thank you so much and God bless. Bye-bye. Pag may question, mag-chat lang kayo ha. Bye-bye.